Hello everybody, I'm Anna Quigley. I'm the Head of Health and Social Care in Public Affairs here at Ipsos MORI. My role today is to act as your host for this event on the future of fats, sugar and the obesity crisis, which of course is very timely following the publication of the National Food Strategy just last week. I'm sure some of those recommendations may well feature in our discussions today. So the format for today, in a moment I will introduce my colleague Lucy Burnham, who will talk through some of the findings, some of the highlights of our report. We spoke to experts around the world to hear their opinions. So we spoke to academics, clinicians, regulators and food producers. We also looked at public opinion on this issue. And the report starts to ask, what's next? And what can we do about it? What's the role for individuals, for industry and for government as well? Then we're going to hear some reflections from our panellists, and we've got a really great lineup for you today. We've got experts with different perspectives. So we're going to hear from Dr. Alison Tedstone, who's the Deputy Director for Diet, Obesity and Physical Activity and the Chief Nutritionist at Public Health England. We're then going to hear from Mark Pritchard, who's the Metabolic Lead for UK and Ireland at Johnson & Johnson Medical. And then we'll hear from Phil Smith, Director General at ISBA, the voice of British advertisers. And then we'll have some time for Q&A at the end. So if you've got any questions or thoughts you want to put to our panel, just type them into the chat box and we'll try and put as many of them to our panellists as we can. So I think that's all from me for now. So I'd like to welcome Lucy Burnham to the stage.
Good afternoon, everyone. So it's my job this afternoon to summarise some of the key insights from our report and to really highlight some of the issues and themes around the critical issue of obesity and to provide some food for thought and some stimulus for what I'm sure is going to be a very engaging panel debate later. So it's fair to say that obesity has had its fair share of column inches in the past. Maybe less so in the last 18 months to 2 years as the COVID's taken over, but it's still a much debated topic, and with good reason. The World Health Organization has estimated that obesity rates have tripled since 1975. What that actually means is that 39% of the global population is now overweight or obese, including a new high of 38 million children. Closer to home, nearly 2 in 3 Brits are overweight. So this is really becoming a burgeoning and critical social imperative to tackle. It costs huge amounts of money. Globally, it's been estimated to cost a whopping 2 trillion. Again, closer to home, the government has estimated that if every overweight person in Britain lost just 2.5 kilos, for those of you like me who still work in Imperial, that's under half a stone, about 5.5 pounds, it would save the NHS £105 million over 5 years through savings on fewer beds, less medicines, and lower prevalence of comorbidities and overweight associated diseases. It's not just recognised as a critical issue for governments as well. Individuals also recognise that it's an issue for them. The figures here on this slide come from a global study we ran in 33 different countries. And over those 33 countries, 45% of the people we spoke to said they were trying to lose weight. There's a big range here, as you can see. 60% of people in Chile said they're trying to lose weight, and we'll come back to Chile later. In China, it's only 30%, but these figures are growing across the globe. What we also know is that COVID-19 has not helped the situation. In 32 of those 33 countries that we talked to, more people had gained weight than had lost weight during lockdown, the only exception being Malaysia. For those who had gained weight, the average weight gain was 6.1 kilos over lockdown. And what we've also found is that when we ask people their perceptions of the critical health issues in their markets, obesity has dropped now from number 2 behind cancer to number 5 on the list of perceptions of health problems. And we know that's an issue because there's a massive relationship between obesity and more negative outcomes in COVID in terms of likelihood to be admitted to hospital, likelihood to be moved into intensive care, and also morbidity outcomes. On the positive side, the World Health Organization has said that this is an addressable, a preventable condition, so it's possible to tackle it. But one of the issues is no country so far has reduced its levels successfully of obesity. And one of the reasons for that is there is little consensus about how to tackle it exactly. So we spoke to 70 experts during our study, and there were some agreement on some key themes, but for the most part, the most common outcome was that actually there was disagreement, which means that governments are necessarily a bit unclear as to the next policies they should tackle, consumers are a bit unclear, and individuals are unclear about what their personal outcomes are and actions should be taken, and also the private sector and corporations and organisations are also perhaps not taking the initiative as actively as they might due to lack of direction. Perhaps one of the ways of looking at it is bringing back to this fairly simple equation that is on the NHS website. What it says is that to lose weight, simply you have to burn more calories than you consume. And you can either do this by eating less, by moving more, or best of all, by a combination of both. But there are barriers to both of these, and let's have a look at those. So we're going to talk about 3 obesity supervillains, 2 of which are named in the title of our report. So we're going to talk about sugar, which is about calories in. We're going to talk about fats, which is calories in. And we're also going to talk about inactivity, which is restricting calories out. So actually, there's quite a lot of agreement that sugar is a supervillain and a major cause of obesity. But there is a spectrum of opinion around whether you should cut it out or discourage it. So we have people like Dr. Robert Lustig, who is a US doctor and paediatrician and expert in this field, who calls sugar a legalized poison. We have, on the other hand, a more mild and sort of considered view from the NHS, which stops at trying to tell people to cut it out. What we do know is that anti-sugar messaging is quite simple. It's quite easy to understand. That means that 28 countries have already adopted a sugar tax of some sort, and perhaps through continued messaging around this subject, consumption of sugar has plateaued in the West, meaning moderation does look like it's a potential. Fats is a much more complex issue because fats range from harmful to helpful. On the one hand, we've got trans fats that are recognised as very negative and banned in Denmark, the EU and the US. On the other hand, we've got positive fats like mono, polyunsaturated fats and omega-3, which actually contribute to a healthy diet. So what that means is we've got a very complex situation. Some fats are good when they're consumed in certain ways and not in other. It makes it very difficult for policymakers, and it also makes it very hard for consumers and individuals to really understand what they should be eating and what they shouldn't. Then let's turn to inactivity, supervillain number 3. What the World Health Organization has identified is that 80% of the world's adolescent population is already deemed insufficiently inactive or active, and those are the adults of tomorrow. 1 in 4 adults do not meet the recommended levels of physical activity either for a healthy lifestyle. And we know what some of the barriers are to this. Sedentary lifestyle is something I think we're all aware of. We have more transport links, better infrastructure, and in many markets, including of course the UK, the last 18 months has shown that actually we can have quite a filled life of some sorts without moving very far from our homes at all. There's another key contributory factor called walkability. Walkability is the extent to where an individual lives in an environment where they can walk, where there are green spaces, it's safe to walk, you can walk to facilities. What we know is that low neighbourhood walkability is highly correlated with low levels of inactivity. And what's really interesting about this factor is that that holds true regardless of age, regardless of our ethnicity, and also regardless of income. There are then also environments which are actively obesogenic. They're actively contributing to helping people be more obese. These are environments where actually the ability to find healthy or fresh food is very limited. To give you an example, a US report from the 2000s identified in Texas, 1 in 5 counties were classified as food deserts. What that meant is the people in those counties could only reach stores that were convenience stores or fuel stores for their grocery shopping. They had no access to grocery and very little access, therefore, to healthy or fresh food choices. So even if an individual wanted to make healthier choices, that wasn't available to them. And finally, there's cognitive bandwidth, which is really your ability to think about longer-term issues like your activity levels if you're struggling to really cope with the basics of life. So if through lack of time, lack of income, lack of education, and a host of other factors, you're struggling or concentrating on paying the rent or providing food for your family or caring for others, really your ability and your ability to think about whether you should be doing more activity is going to be very limited and very low down your priority list. So those are the key issues around inactivity. We've also got what we're calling some supervillain sidekicks. So lack of education is one, and just to give you an example, again, 2 in 3 Brits have no idea about what the level of calories should be to maintain a healthy lifestyle and a healthy weight. We talked about the availability of healthy and non-healthy foods. There's also an issue around lack of clarity, portion sizes versus serving sizes. Which should I be looking at? What is the right one for me to make sure that I'm maintaining a healthy calorie intake? We've got the cost of healthy foods versus non-healthy foods. It's been much discussed that in the past, a lot of the price promotion, a lot of the multi-buy activity in many, many markets has been biased towards non-healthy foods. And finally, there's also the bias of advertising support, which again, for many markets for many years has been towards non-healthy foods. So it's clear at the moment that obesity will continue, and our diets and behaviour must change if we are going to improve our health and well-being. The question is how? And also, who is responsible? So we've thought about this in terms of 3 groups of bodies, companies, people that could help address obesity. So we're going to talk about the role of the individuals, my personal role. What can I do to help prevent or curtail my obesity? What can governments do? What policy can be legislated to help this issue? And also, what's the role of the private sector? What's the role of brands and companies in addressing obesity? What's definitely clear from our expert panel is that a team effort is required, and it's going to require a collective addressment from all of these. And it's also the same that public opinion reflects that as well, certainly in the UK. When we ask people about how much each of these 3 bodies have, how much responsibility they have in tackling obesity, 94 people said yes, individuals have a role, 83% of the people we spoke to said yes, companies had a role, and 70% said governments had a role. So it's clear there is this 3-way responsibility. So coming on a little bit to touch on some of the issues around each 3. Governments first. What we're showing you here is essentially an obesity map to set the scene. Those countries that have higher levels of obesity are in varying shades of pink and red, and the lower ones are in blue. And what you can see here is obviously the spread across the globe of obesity and the problem that it is. And governments really have a choice, whether they're mandating, whether they're taking a policy approach, or whether they're encouraging encouraging behaviour with more nudge tactics. Let's go back to Chile. Remember, we saw in Chile that 60% of the individuals we spoke to said they were trying to address their weight. And Chile is a country that's been seen as the poster child. They have adopted a lot of policies, so sugar tax, advertising restrictions, promotional toys, and warning labels on unhealthy foods, all to try and address the big issue they have there with their obesity. Closer to home again, in the UK, we've got a mix of things. So we've had persuasive campaigns from Public Health England, NHS Better Health campaign, and also Sports England. But also, we also have a raft of policy measures, the most recent, of course, being the restriction of the online high-fat, sugar and salt ads that I'm sure we'll discuss later. So really, for each government, the question is, how much do you mandate, how much do you encourage, and what is going to be the most successful combination? Coming on then to the role of the individuals. So we know that certainly in the UK, individuals do recognise they have a large part to play. But we also ask them, what do you think that would be the most helpful measure or helpful thing that companies and governments could do to help you? And what we found out here is that the prevalence of cheaper, healthy foods was felt by individuals to be the most useful thing, especially by the people who are trying to lose weight. Second and third on the list were measures that would contribute to activity, so more public green spaces and more public exercise facilities. What's quite interesting is that restrictions on advertising comes right down the bottom as something that would actively help weight loss. However, we also know that actually when you ask people about what they think about banning, restricting advertising, they're actually in favour. What we know, though, about the role of the individual is that there is a gap between what people say they will do and what they actually do. And therefore, we know that whatever the public want to do, they're going to need to be supported. They're going to need to be supported by education, making it clear what people need to do, by removing barriers that are preventing people from making healthy choices, and by encouraging and reinforcing behavioural change as well. So finally, of our triumvirate, let's come on to the role of the private sector and the corporations. What can brands do? What can companies do to proactively embrace this challenge and to help tackle it? We're just going to give you a few examples here of how companies are starting to address it. The first one is McDonald's. Actually, this isn't really one that's tackling health so much, more as the wider environmental and sustainability agenda, but McDonald's now looking into plant-based foods, the PLT here. We've also got Birdseye in the UK saying they want to democratise plant-based food, and we've also got Walkers recently announcing that they're going to support and promote their lower-calorie snacks. As far as promoting activity goes, we've obviously had quite a lot from the public sector over the years. We had that Sports England This Girl Can campaign around about 2017. This one is a similar one from Nike. So where Sports England This Girl Can was promoting people, women to get involved and do exercise whatever they look like, this one from Nike is about trying out sports and activities however terrible you are. And I would encourage anyone to watch it. I think it's a lot of fun. There's a vignette in there with a woman trying to play tennis and failing. She hits the net, she misses the ball. It really reminded me of being 14 and giving up tennis and made me think that I ought to have another go as well. And then finally, we've got an example from a retailer. Sainsbury's moving away from a positioning around costing less to helping everyone eat better, which is partly about health and it's partly also about sustainability. So it's clear that the private sector can help and should help as well. So I just want to finish off by reading this quote from the latest government report. Helping people to achieve and maintain a healthy weight is one of the most important things we can do to improve our nation's health. I hope today we've demonstrated how that is true and how there is a collective responsibility for governments, for individuals, and also for brands and organisations. Thank you.
Thank you, Lucy. I think what was really interesting there was the lack of consensus, and perhaps that's what's affecting our progress in this area and something maybe that our panellists will reflect on. We are going to turn to our panel now. So first of all, I'd like to introduce Dr. Alison Tedstone. So Alison is Public Health England's Chief Nutritionist and leads its nutrition programmes, including the National Diet and Nutrition Survey. She provides scientific advice and actions to improve diet and promote physical activity. Her team lead work aimed at tackling obesity. Alison works closely with the Department of Health and Social Care on obesity policy. Her team monitor food industry action to reduce the sugar, salt and calories in everyday foods, and the soft drinks industry levy. Alison, welcome to the event. I personally can't wait to hear your reflections on this issue.
Thank you very much. It's a real pleasure to be here and to contribute to the debate. So we know that, as the report clearly sets out, obesity is a problem, and this is not a new problem. The nation has known it's had an obesity problem for many years. So the question is, how do you frame it and what do you do about it? And in this report, you framed a kind of a very even framing, which talks about education, information and physical activity as being part of the problem. The government has argued in its childhood obesity strategies, and the most recent strategy published last year, that we need to go way beyond information, education and physical activity, because that will not change the dial. We know on average adults are consuming more 200 to 300 calories a day, more than they need. And our research shows us that we cannot address that by increasing physical activity. Increasing physical activity is important in weight maintenance. It will help you lose weight, but it will not tackle that degree of calorie imbalance that the nations has. I would actually challenge Ipsos as well in your finding that there is not consensus, because actually there is more and more consensus from governments, at least around the world, and from experts in public health policy about what needs to be done to tackle this. It is clear that our environments are majorly affecting our food choices and our calorie intakes. When we look at what the nation is buying, and indeed most countries are buying now, we can see that they are buying a diet that is high in salt, fat and sugar, and high in calories. And if you think about how things have changed over the years, you wander down any high street, and pre-pandemic it had become a bit of a food court, not very much being sold out of it other than food. You sit on your sofa and you look at your phone and you'll see that there are adverts for unhealthy foods, and a lot of very clever advertising that arrives in your Twitter feed and so on, and encourages you to just ping to buy that pizza delivered to your sofa. We've seen a great rise during the pandemic of delivery and takeaways. We've seen growth in our fast food chains. They are all predicting that that will continue post-pandemic. And that's really bad for the nation's waistline, because food that we buy through the out-of-home sector, our fast food chains and so on, tends to be double the calorie level than it will be if you buy it from a retailer. So people might not know precisely how many calories they need, but actually they do have quite good education and a bit information on what they need to eat. Most people know they're consuming too many calories. They're rather optimistic in how much physical activity they're doing. They know they need to have more fruit and veg and consume less salt and less sugar, but they find it hard to do. And I would argue very strongly, and indeed government has argued, that is because the environments we are in is nudging our choices away from the healthy. So if you think about it, when you go around a supermarket, those promotions we know are very biased towards unhealthy foods. And actually you could add to your slide on UK policy that we saw published yesterday, the regulations about controlling the promotions of unhealthy food, which I'm really delighted to see. You've already mentioned that those television adverts and those adverts online are very biased towards unhealthy foods, and yet you will hear the industry repeatedly arguing that does not affect food choice. It only causes brand switching. Research shows that it doesn't just encourage brand switching. Indeed, it causes an expansion of food categories. So Public Health England has been monitoring for government the sugar reduction programme, which asked industry to take 20% of sugar out of the foods most commonly consumed by children, contributing to their sugar intake. And we've seen some great successes in that programme. Our breakfast cereal industry have really stepped up to the plate and have taken a large amount of sugar out of their products. We've seen our yogurts and fromage industry do the same, and some good progress from ice creams. But for the confectionery industry, we've seen no progress at all. And indeed, we've seen confectioners highly advertise and promote their products, and that has led to a 17% increase in the amount of confectionery being sold. We haven't suddenly developed huge chocolate appetites. The reason we're putting it more in our trolleys is because it's being promoted very heavily to us, and that shapes our food choice. Now, there is a narrative going that our businesses will support this, and absolutely we've seen some great stuff by businesses. I've already called out our breakfast cereal companies, but when you look at the portfolios of the largest global businesses around the world, you see around 2/3 of what is being sold not passing any marker of healthfulness. They are 2/3 of the products are classified as unhealthy foods. And that's a really worrying thing, because this narrative that you just need to find those healthy choices, if you educate people, they'll find those healthy choices, is just wrong when you know that the market is dominated by the unhealthy choices. I noticed you talking about food deserts. We spent a lot of time and effort researching food deserts in this country, and we don't have them in the same way they do in the States. Access to fruit and vegetables is not a barrier to consuming fruit and vegetables in this country. So I would just put a bit of caution about drawing conclusions from other countries and transcribing to us. It's a great pleasure to be on this panel with a marketing expert and a treatment expert. I would, however, say that advertising industry is very heavily argued that because the calories gained from reducing advertising is small, it's not worth it. Well, actually, the economic analysis shows that in the long term, it is really worth it. It helps protect our kids and reduces obesity levels. We heard Henry Dimbleby last week, and many of you will have listened to it, arguing to support this narrative that small calorie reductions through controls of the multiple things that are influencing our food purchase and our diets are really important, and we should not step away from that as a nation. I will refer to treatment just because this colleague from Pharma here. And yes, of course, treatment is an important part of the equation. But in the same way we can't educate ourselves out of this problem, we cannot exercise our way out of this problem, we cannot treat our way out of a problem as a nation. We can't afford to put everybody through bariatric surgery, and indeed the risk benefits of bariatric surgery are too high to even contemplate that. So in conclusion, just to say that really pleased to be here, but we have to go beyond the dogma that constantly gets recycled around, that this is all about just enabling a few healthy choices and jobs solved. Industry need to be part of the solution as well as being part of the problem. But it is clear, as the UK government has clearly stated, that further actions are likely to be necessary in this space, not least because during the COVID pandemic, it's become even more apparent than it's ever been before that obesity is affecting our NHS. We had an huge overrepresentation of people living with obesity in our ICU units. Obesity was having an immediate effect on their COVID risk and crystallizing the terrible consequences it can have for your health. So celebrate being here, but I think there is a need to change the dial on what needs to be done. Thank you very much.
Brilliant. Thanks very much, Alison. I think you've set up the rest of the panel really nicely there. So now I'd like to introduce Mark Pritchard, Metabolic Lead, UK and Ireland for Johnson & Johnson Medical. Mark has spent the last 12 years at Johnson & Johnson Medical Devices, where he's worked across specialties within the NHS and the private sector, looking at patient pathway optimisation and improved outcomes. Over the last couple of years, Mark has been focused on metabolic disease and obesity, and how increasing support and treatment can help people living with obesity live healthier and longer lives. Over to you. Welcome, Mark.
Great, thank you very much, Anna, and it's an absolute pleasure to be here today with the colleagues on the call, and obviously thank you to Ipsos MORI for including me. Thank you also for the research that you've undertaken in this area, and particularly within obesity. It's already been highlighted, but obesity is one of the most important global healthcare challenges that we face today. And as such, I'm pleased that obesity is a priority for the UK government and so many governments across the globe. As already highlighted today, obesity is an incredibly complex topic. Whilst understanding the need to simplify the message, we must also be cautious of unintentionally disseminating a message that does not now align with the extensive empirical evidence that demonstrates that it is multifactorial, multi-level health condition. Simplifying the complexity of obesity in both prevention and treatment can misrepresent many of the challenges that are faced by people living with obesity, as well as the associated challenges for the wider system in healthcare and indeed across society. For years, we have seen simple messages about obesity. From a treatment perspective, the eat less, move more rhetoric has been an ever-present and is an injustice for people living with obesity. The simplistic message that does not capture the complexity of obesity and indeed weight management. Having a detrimental impact on public perception, stigma, discrimination, we now know is pervasive in the UK. It's impacting the development and implementation of appropriate weight management and obesity services, including prevention, management, and treatment for people living with obesity. And we know that it is having a detrimental impact on people living with obesity through internalizing weight bias, as well as the associated social and economic impacts associated with living with obesity. At Johnson & Johnson, we are trying to use our breadth, scale, and experience to reimagine the way healthcare is delivered to people to live longer, healthier lives. In the UK, as one of the largest and broadest healthcare companies and partner of the NHS, we are determined in our mission to support as many people living with severe and complex obesity. And to Alison's point, that doesn't just form around treatment. That does include how we educate, increase awareness, and support people for the right intervention that is appropriate for them to gain the best possible outcome. It is not appropriate for everyone to move to surgery. Likewise, we also know that diet and exercise isn't effective for many people in a severe and complex setting. Therefore, we have to take a holistic approach. We believe that it is therefore imperative to create a whole system approach to improving education, understanding, acceptance, and acknowledgement across both government, public, healthcare, and private sectors to aid both prevention, management, and treatment for people at risk or living from obesity. Contrary to popular opinion, obesity is not a choice. Evidence tells us that there is clear association between obesity and an array of metabolic and mechanical health risk factors. And as such, by supporting people to lose clinically significant amount of weight, this can reduce the risk for health conditions. For instance, obesity is a gateway disease to over 300 comorbidities, and the Centre of Disease Control and Cancer Research UK suggests increased risk of 13 types of cancer, cardiovascular disease, chronic kidney disease, and diabetes. As I have already stated, obesity is not a choice. For many people, diet and exercise alone will not work. The government in 2007 published the Foresight Report, which identified over 100 different influencing factors for obesity across several detriments and social influences: individual psychology, individual activity environment, food consumption, food production, and biology. Unless all these factors are addressed simultaneously, individuals are supported in all areas. Single initiatives will continue to have little or no impact. For example, since initiatives like the sugar tax, Eat Less, Move More have started, rates of obesity have actually continued to increase. There is no doubt that reducing sugar intake is beneficial. It will benefit everyone across the population. And so this represents a great population health intervention. However, it is unlikely to have significant impact with people already living with severe or complex obesity, and thus more complex interventions are needed. You have also added complexity. You also have added complexity that runs in parallel and magnifies when you add the social stigma and prejudice, the inequality that people living with obesity face on a day-to-day basis, not only across the globe, but especially in the UK. Research has shown that there has been a continued increase in weight stigma alongside the increase in obesity prevalence. And we know that stigma are impacting access and engagement within healthcare. In recent months, we've been working with Ipsos MORI specifically on the stigma, prejudices, and empathy surrounding obesity. The information we have gathered and will soon be published, the findings are actually quite disturbing. Empathy and awareness understanding is particularly lacking across the public, government, policy, and healthcare practitioners. Participants describe their interactions as challenging, unsupportive, and spoke about being reluctant to seek help due to the responses that they are given. When this is combined with mainstream media, the narrative falls into a rather binary blame culture around fault line with individuals or FMCG manufacturers, and completely misses the nuances between complexity stigma that we are seeing in the research. And whilst I welcome the updates to the National Food Strategy published on the 15th of this month, without the corresponding education, correct narrative, and access to healthier foods, the sugar and salt taxes, along with many other initiatives, could potentially have low impact on people living with obesity, and in particular, those living with severe and complex obesity. These initiatives could also add fuel to the stigma fire, with some people pointing the finger at those living with obesity for prices going up. This has already been reported by UK researchers relating to the soft drinks industry levy. Despite little evidence behind taxation impacting obesity rates, one positive is the announcement that some of the money raised will be reinvested into supporting healthier food initiatives. Whilst this is again needed at a population level, the complexity of obesity calls for funding at a more complex interventions. Therefore, this taxation is likely to generate income into the billions of pounds, and therefore one idea may be to reinvest some of that funding to support the holistic approach to prevention, management and treatment for individuals and communities. In summary, the future does not lie in single initiatives which focus on one area, i.e. diet, exercise or behavioural change, but a holistic whole systems approach which supports education, awareness, acceptance and acknowledgement of the complexity of obesity. As a nation and industry world leaders, we need to change the narrative, remove stigma and prejudice, work cross sectors, industries and government with policymakers to recognise that obesity is complex and that different strategies work for different people. We must be open to increasing all types of prevention, management and treatment, including medical, and work together to provide long-term sustained support for people living with obesity. Remove individual blame, stigma, prejudice, and support people to access the intervention that helps them the most. Thank you very much.
Brilliant. Thank you for that, Mark. I think that was a really useful reminder there of the sort of the holistic nature of this, and something that's actually prompting some questions on the Q&A. So just a reminder for anybody who's got questions, do put them in the chat box, and we'll be getting to them shortly. But now I'd like to introduce our final panellist. So Phil Smith, Director General at ISBA, the voice of British advertisers. Phil's broad marketing and general management career spans packaged goods, grocery retail, consultancy, and marketing technology startups. He spent 10 years at Kraft, latterly as Vice President Strategy for Western Europe. He's also held senior posts at QuickSave, Summerfield, and Camelot. So, Phil, welcome to the event. Really looking forward to hear what you've got to say on the subject.
Thank you, Anna. I've never been introduced as a villainous sidekick before, but there's a first time for everything. But much more seriously, this report underlines just what a tough, complex and intractable problem we're dealing with. For me, at least, the physical science is debated is less of an issue than our poor understanding of the social, individual and environmental factors that all play a part in combination. I do think the report is a very constructive contribution. I'd certainly recommend reading it, and I'd do so alongside the incredibly thorough and considered National Food Strategy. So stand-back reflections on the report for me are, there is no international success story or template to follow, which makes the government's goal of halving childhood obesity by 2030 a lofty target. At the individual level, there's a massive struggle. With 45% of us striving to lose weight, there's an internal battle that needs to be fought every day, where we know logic and knowledge don't always win. Within my remit, as the voice of responsible British advertisers, there's that question of the advertiser's role going forward, both in the implementation of restrictions and in the positive promotion of healthier lifestyles. And it's also about our expectations of what those efforts can achieve. The report does make it clear, as I said at the beginning, that advertising is a contributor and not the principal villain. And I do note in the report that people, the public, say that the best initiatives were providing cheaper, healthier foods and access to more exercise spaces and facilities. New restrictions on advertising were bottom of that same list, albeit popular. But any seasoned marketer would tell you that taste, convenience, physical presence, availability and price are far bigger demand factors than advertising, on which we tend to overfixate, I think, because it's very public and it's relatively easy to tinker with. Now, the lack of impact of ad restrictions alone will be no surprise to those who've looked at international markets like Quebec, where a total ad ban has resulted in no change from national obesity trends. Of course, advertising is designed to have an influence on perceptions and behaviour, but it is by no means the only influence. And I think here the National Food Strategy evidence does provide a really convincing construct of the cycle of economic incentives propelled by deep human drives. Personally, I find it really disappointing that the government seems to have dismissed out of hand the principal recommendations of the Dimbleby report. But advertisers do recognise the need for advertising regulation as part of a comprehensive approach. Competitive pressures do require us to have a level playing field. Regulations have already changed, now some of the most restrictive in the world, placing TV ads away from programmes produced for kids, prohibiting targeting elsewhere. We've got a world-class self and co-regulator in the shape of the ASA, which is evidence-based and proportionate, and it's backed by a well-established audience measurement system for TV in BARB. We do need better and more accountable audience measurement online. Getting a gold standard audience measurement there is my number one priority, working with all parts of the industry to deliver a global prototype of a comprehensive cross-media measurement solution. And we will start to see that, we hope, come into play next year. But also regulations are tightening further. Advertisers do not oppose the 9 p.m. TV watershed planned in legislation, though the evidence of benefit we would say is weak. Online, we prefer the measures proposed in industry codes to effect a comprehensive ban for children, rather than government's plan for a total online ban for paid-for ads, with significant exceptions, for example, for SMEs. The draft bill requires much guidance and clarification, and advertisers are worried about the timetable for practical implementation. We do think government has been short-sighted in its outright rejection of online targeting as a means of restricting exposure, and in rejecting the industry regulator as the rule setter. When it comes to positive industry measures, there are some really good examples in the report which probably underplay all that's been done by many other brands. I don't recognise the description of brands as lackadaisical, but I do see the impact of technical challenges, competitive pressures, and lack of consumer demand as brakes on further progress. Palatable reformulation is a lot easier to say than do in some categories. There are other recent examples of initiatives being backed by industry. So the Daily Mile focused on activity and Eat Them to Defeat Them focused on veg. Those have been backed by broadcasters. But these efforts should all serve as a reminder that brands do have an inherent interest in the long-term reputation and value of their brands, whilst of course giving people what they want profitably. However, we should also remember all these previous campaigns collectively have not worked to reverse the trend. So I think brands and advertising can shape opinion at the margin, but they can't turn the tide. Successful brands spot the wave early and ride it better than their competitors. I'm hesitant to believe, for example, that carbon footprint, sustainability and environmental impact can be leveraged in the foreseeable future to increase consumer demand for healthy alternatives. Without some more fundamental improvements in positive life prospects for those in deprived areas who are most at risk. I suspect that those who are most interested in sustainability today will be some of those with the healthiest diets. However, we will continue to work with government, with health bodies and regulators, but the dialogue does need to be two-way and it does need to be less schizophrenic. Right now, I would say that advertisers believe they are being portrayed as the pantomime villain rather than joint owners of the problem. But more importantly, I do worry that all the ad restrictions in the world won't solve this crisis that we must address more fundamentally. And I think that's clear from the report. Thank you.
Brilliant. Thanks very much for that. Really useful contributions from each of our panellists, all with different views as we thought. We've had plenty of questions coming through, so I'm just going to go straight to them. Actually, Alison, I've got one for you first of all. And this is partly from me. Just listening to your fellow panellists, you talked very much about the role of industry, and industry must do more, I think was a key message from what you said. And then we've just heard from Phil at the end about that can't be the only answer, and we talked about it being a holistic problem. Can I just put that back to you, sort of where does the responsibility lie?
I agree with Phil and Mark, actually, on the points that they're making about it being part of a whole system that needs to be thought about. And of course, restricting advertising is only one of a whole number of things that affect obesity rates. And indeed, you wouldn't ever expect from a single intervention like restricted advertising that obesity rates would change. Mark is absolutely right to raise stigma. Stigma is a massive problem for individuals living with obesity. Certainly Public Health England takes advice from people living with obesity on the framing of our campaigns, and we try and make sure we try not to contribute to that issue by framing them positively and empowering, and I'm sure we can always do better. But yes, a whole systems approach is really imperative. And I suppose I also I might have led the impression that I don't think information education is important. I do think it's the foundation of everything that should happen, but it needs to be accompanied alongside bigger, more impactful things. Henry Dimbleby talked a lot about the economic cycle that drives ever worsening diets, and he's making a really important point about this. Of course, the food industry is doing what it says, what it has to do. It's not a not-for-profit industry. It's not there just to do public good. It does a really important job in feeding the nation and feeding us with exciting and vibrant products. But we do know that on average, the food industry is expanding, and that inevitably means that we will have to respond by buying and eating more calories or increasing waste. And I also agree with Phil. I have sympathy with what he's saying in terms of the people who care about climate change are probably exactly the same people who care about a healthy diet. I think that's inevitably true. But there may be opportunities across government to link the climate change agenda, the sustainability agenda, more into the obesity agenda, so more of us can see a win-win for it. The reason the Amazon is being burnt down is because of the ever-increasing calorie demands of the world. And in reality, every continent has an excess of calories. There are now more obese children living in some cities in low-income countries such as Kenya than there are in London. And as a global citizen, we should really care about that, because to face an obesity crisis without a healthcare infrastructure is a really dreadful thing to be doing. So we can't just export the problem and links to nets. Anyway, I'm babbling on now, but there is actually commonality as well as disagreement amongst the three of us, I think.
Good. Perhaps that's where the solution lies, is that commonality. One of the things I want to...
Not always.
Maybe I'm being a bit optimistic, but one of the things I wanted to pick up on, which you've mentioned, Mark, I think you mentioned it as well, and some questions have come through particularly about this sort of stigma of obesity, and what can we do? I'm going to put it to you, Phil, as an advertiser. What can be done to address the stigma of obesity?
Well, that is quite a hard one. I mean, there's obviously quite a lot that's already being done about body image in advertising, and not portraying unrealistic, stereotypes. And I think we know that a lot of people say that they don't see themselves when they see advertising, advertising portrayals. So I think that's a really important first stage. I think when it comes to destigmatizing obesity, that for me is a harder one. At least I'm not quite sure how you would do that, other than to give people incentives and help them on the way to something that is healthier. And we've certainly seen that there are progressive advertisers who are portraying a much more broad array of individuals from diverse backgrounds, as well as those with obesity within their advertising. But it isn't a general thing. I agree.
Okay. Great. I'm going to go to Mark now. We've got a question specifically for you. I'm going to read it out to make sure I've got it right. Why do you say that taxation would raise resources into the billions of pounds? Surely the greatest population health gains would come from tax that incentivise reformulation to avoid price increases.
So first of all, thank you for the question. I think my point around the taxation at the moment is we know that taxation in general, the sugar tax previously has, one, raised significant amount of funds, but hasn't really changed behaviour from a purchasing standpoint. So we have still seen, a shift in products. We haven't necessarily seen a massive change in the behavioural change. So another tax, particularly on sugar and salt, we would expect, obviously, funds to be raised, significant funds, which have been called out and have been suggested of reinvestment. Now, if there is another way of doing it, of course, I think, yes, potentially a better option, which would then reduce, and similar to what Phil was saying, would then reduce the impact that this may have on stigma, prejudice, that tax levy is then being focused on people living with obesity and people therefore point the finger. So, yes, if there is an incentive to reformulate by taxation, that's even better. I think at the moment the current system is it's used as more of a behavioural change, and we know from the past that hasn't necessarily been as effective as maybe we would have hoped it to be.
Okay, Alison, did you want to come in on that?
Yes, I do. So we know from the international literature, and actually there are big systematic reviews on this now, that sugary drinks taxes do change purchases. The UK, so it's just incorrect to say it doesn't drive behaviour change. The sugary drinks taxes do have to be large enough, so very small ones won't have any effect. The UK levy is unique because of the way it's been set around reformulation, and it has led to massive changes in purchases. Sugary drinks are now 44% less sugary than they were in the past. That's a massive public health win. It's the biggest one I've observed in my career in the diet front. So we should all be very proud of it. And I think indeed, rather oddly, the sugary drinks industry are actually proud of it because they've managed to survive. They've managed to sell more diet products. And we know from our National Data and Nutrition Surveillance Programme that not only has the sugar content of drinks been reduced, but the amount of sugar people are consuming from drinks has gone down. And indeed, without the increases in sales of confectionery that I mentioned before, we would have seen big changes in the amount of sugar within shopping baskets. So I'm very proud about my role in the sugar levy, and it's just it may not have been associated with changes in obesity rates, but as Marcus reminded us, obesity is being driven in a system by a multitude of factors, and sugary drinks are just part of that mix.
Picking up on that, actually, we've had a few questions about demonising certain ingredients. So first of all, actually, I'm going to go to Lucy, because we called them supervillains. Is that helpful? We've had a challenge that perhaps it's not.
I think that we didn't use the term supervillains in the report, and I do apologise, Phil, for inadvertently calling you a supervillain sidekick. That wasn't really my intent, especially as I personally work with a lot of advertisers. So supervillain was just a term we coined today for the purposes of a bit of drama in this presentation. We wouldn't use it outside of this kind of informed audience. I guess the question of whether though the helpful good or bad ingredients is helpful term is perhaps one for one of our panel.
Yeah, Alison, do you want to take that? And then I'll come to Phil after that, I think.
Sorry, I'm just struggling to take myself off mute. So, do I think sugar is a bad ingredient? No, it's a perfectly reasonable ingredient. Do I think, though, that too much of it is being used within the food chain? Yes, I do. And I think that, obviously I'm very supportive of sugar reduction. We know that too much sugar increases the rate of weight gain, increases the risk of weight gain, and is associated with type 2 diabetes and causes your teeth to rot. It's fairly important, and pressures down on the NHS. So I don't like to demonise things. I think that's just wrong. You know, don't like to say it online. I like lots of things that, you know, in moderation. But the trouble is, we're not consuming it in moderation. We're consuming very high levels. But actually, when I was talking a lot about the out-of-home sector earlier, the expansion we've seen in food on the go is really about calories. It's not about sugar. It's not entirely helpful to be having so many takeaways, even though it's important to be able to have a treat. I think we've kind of distorted the idea of what counts as a treat. And if I'm not careful, I'll start talking about when I was a child and you were only allowed things very, very occasionally, and now they're a regular everyday event.
Okay, and thank you. And Phil, what's your view in sort of demonising certain products, maybe creating fear and anxiety and confusion around what's okay and what's not?
I don't think it's at all helpful. The Greeks had a saying, nothing in excess, and I think that's very much what we need to be thinking about here. I'd also, you know, point back again to the Dimbleby report, because I do think there is there should be huge attention on the way in which the economic cycle has developed, and you know, creates a vicious circle as a result of the way in which you know, consumption and accessing people's tastes leads to you know, economic incentives and economies of scale, you know, that don't create a better diet for us. So I do think that there's a lot in that report that needs much more careful consideration and study, rather than the outright rejection, because it certainly makes the advertisers feel as though, you know, we are selectively still the pantomime villain. As I say, we're, you know, more than happy to play our part, but it is more complex. And I certainly think getting to the bottom of the economics as well as the behavioural issues is important.
Okay, thank you. We've had Ron on the role of the NHS. Actually, Mark, I wonder if you can take this. I know that you have worked with the NHS and private sector. So one of our audience has asked about the role of NHS in actually tackling obesity itself. What do you say to that?
Personally, I think the role that the NHS will play a fundamental role. The challenges at the moment, the obesity within the NHS and for varying reasons has not been prioritised for multiple years, and it comes back to the sort of stigma that is associated around obesity being a choice. There are some fantastic services within the NHS which do brilliant work in supporting people living with obesity for varying forms of prevention, management and treatment. You have varying services from weight management services through to surgical intervention, all of which are highly successful in allowing people to get treatment when they get access. The fundamental challenge is between referral funding and capacity. There's not enough capacity across the NHS when you add in the likes of cancer services, digestive diseases, women's health, etc., for everybody to get treatment. Obesity at the moment is the one disease state that really isn't prioritised in the rest of them. And that's not to say that it should be as much, but if we can increase access to a lot of the work that is being doing, there is the possibility to create systemic change. The other challenge is that at the moment, weight management services from GP through to specialist services within the Tier 4 sector, therefore within surgical societies and medical management, is not joined up. They're very siloed, which traditional pathway for someone seeing their GP to surgical or medical intervention is 3 years. 3 years, obesity as a disease can progress significantly, as can the comorbidities that are associated with it. You know, if you had a patient who is suffering from cancer, their treatment option is within 2 weeks from referral, 4 weeks to full treatment. Someone living with type 2 diabetes and high risk comorbidities has the same prognosis as someone living with stage 2 cancer. Yet someone with obesity and significant disease will take 3 years to get to some form of significant intervention when it could be life-changing for them. The NHS has some fantastic offerings. The biggest issue is we just need to make sure people get the right access to the right treatment at the right time. And that's the biggest hurdle that we've got to overcome.
Okay, I think it shows just how much there is to talk about on this issue, but I'm afraid we're going to have to leave it there. So we haven't managed to answer every question, but we've had a really, really interesting debate today. So I'd like to thank our speakers, also thank everybody in the audience who did put your questions in. Sorry if we didn't answer your question. Just to say that the report is available on our website now, but we will be emailing it out to everybody who's registered for this event. So thank you again and have a lovely rest of your day.